We contract with home health agencies to do the occupational, the speech, and the physical therapy. So we're helping people move around all the time, and you are helping people move around all the time. The first thing I wonder, I know most of you are pretty new to Bright Star, and some of you are new to the profession too, of being a caregiver in home. How many of you guys have ever hurt your back? Okay. Have you ever done it while you're helping someone? Yeah. All right. It's pretty easy to hurt your back. How many of you know a CNA who's been working in the field more than 10 years? All right. How many of you have been working more than 10 years in the field? Yeah. How about 15? And 20? Awesome. You guys are veterans, so you know all the tricks. The disclaimer I tell all my patients when we meet them is, we're here to help them, and physical therapists won't tell you this, but they're not always right. So I'm going to come up with some solutions for transfers that may or may not work for your patients. You're always going to have exceptions, and you're always going to have people that are different. Hopefully, I'm just giving you a foundation for basically what a transfer is, what you're moving, and how to do it in a way that helps the patient do it the most. And all said and done, the hope is that you can help the patient be the safety factor, and that they can be the one that drives their own mobility instead of you just carrying them all the time. Make sense? Mm-hmm. Okay, first of all, what is a transfer?
Moving from one point to another.
Moving what from one point to another?
Your patient, your client.
Well, it's actually a person moving themselves from one person to another. And you're helping there and facilitating that, right? So what are you actually moving with a transfer? What gets moved?
Weight.
Your weight. What about your weight? It's actually your center of gravity. Where's your center of gravity?
Hips.
Core.
Hips, core. For men, it's actually almost always your belly button. And for women, it's about 3 or 4 inches lower because y'all have hips. Thank goodness, right? But that really applies to what you're moving, right? So everyone, you should know about where your center of gravity is. Another way to think about it is if you took something and you spun it like a basketball, you put your finger right on the axis of rotation. That's what you would do with a body. Think about spinning a body. You spin the person, you put your finger in their navel if they're a guy, and a little bit lower if you're a female. It's kind of weird to think about, right? And you see figure skaters do it all the time for the vertical axis, right? So if we know what your center of gravity is, have you ever heard of the term base of support? Yes, what is the base of support?
Base of support is your feet and how far apart they're planted.
That's definitely related to that, and that is right on target because it might include your feet, and it might include a lot more than that. Mm-hmm. It's basically what is keeping you upright, or what's holding you. So right now, when you're sitting here, what is your base of support?
Chair.
The chair plus?
Your back.
Plus your feet, right? Because the chair is in contact with the ground, and your feet are in contact with the ground. And if I come up to something and I lean on it, what is my base of support now?
Your arm. Chair.
Your arm.
It's my feet and the chair, right? So that applies when you're walking with someone and when they're sitting and when they go from sitting to standing. And that base of support changes a lot. So right now, your weight, your center of gravity is over your sitting bones. And so when you're sitting, your body, the part that's in contact with the ground is your sitting bones. So I want everybody to put your hands under your sitting bones. Reach down, put your weight on there, and then sit back in the chair. But I'm making you do it. Ha ha ha.
We're good.
Can you?
Are you ready? Okay. I had you put your hands under your sitting bones because I wanted you to feel how much weight is on your hands. Now I want you all to look at your shoes. Bend over really far and look at your shoes. And the further you get, I want you to tell me how much weight is on your hands now. Look, bend all the way forward.
A lot less.
A lot less, hardly any at all, right? Okay, you can take your hands out. Now, what I want you to do next is to stand up and sit down one time. Okay?
I'm not moving.
All right, what did you feel in your knees and your back? All right, we're going to do it again. And I want you to look at the ceiling and stand up and sit down. Okay. What did you feel?
Nothing. Muscles.
Muscles? What muscles are working?
The legs.
Your thighs, yeah.
The back. Stomach muscles.
Yeah, okay. And then I want you all to look at your shoes and then stand up and sit down. And what do you feel when you do that?
Just legs.
Where are your legs?
Thighs.
Thighs.
Yeah, so both your thighs and your, yeah. Okay, so when you're doing the weight shift for the transfer, you're shifting your weight, you're transferring the weight, your center of gravity, from your sitting bones to your standing bones. So that's really the most basic way to think about a sitting to stand transfer. You're shifting your weight from where one position to the other. So the sitting bones forward to the standing bones. So as you do that, it's affected a lot by where your center of gravity is. And so when you're sitting upright, your center of gravity was over your hands. And when you moved forward and looked down, your center of gravity actually went over your feet. That's what has to happen for you to stand up. So I want you to stand up in slow motion and sit down in slow motion. And when you stand up, wait 1 second. When you stand up, I want you to look at your shoes, and I want you to feel where your center of gravity is. And then when you sit down, I want you to look at your toes and bend all the way really far forward and then sit down. So everybody try it one time. Where do you feel? And then look up now and sit down. And where do you feel? So you're controlling that weight shift in a different way. What did it feel like? Okay, so nothing's different when you look up or look down?
I didn't think so, yeah.
What was different for you?
For me, I had to hold on because I feel it right here.
You're using your hamstrings when you have one
Yeah.
position more than the
Yeah.
other. Yeah. So when someone's trying to stand up, was it harder for you to stand up when you were looking at the ceiling or when you were looking at your shoes?
Shooting.
Most
Shoes.
people, when they're looking at the
Shoes.
ceiling, it's harder.
Oh.
Because the weight shift,
Feeling.
right? The reason I had you lean forward is you could feel the weight going to your feet. Right? So your torso and your shoulders and your head, my wife says I got a giant noggin and I say she has a little one. When you lean forward like that, it drags your center of gravity forward over your feet.
Right.
And so that weight shift happens really fast when you do it that way. When you have your shoulders back and you're looking up and you try to do the weight shift, it's really awkward. You have to like kind of shimmy around and work to have it. So can I get a volunteer? Actually, you know what? I don't really like doing that.
We can just use it right
You
here.
guys need to tighten this.
Oh, yeah, good idea.
Yeah, you need to tighten the screws here.
Okay.
So,
Yeah.
yeah, I'm gonna borrow that chair. So that's a simple thing. When you're in someone's house, this is a huge part of risk management for you. Do you guys do bathing?
Oh, yes.
Right? So if they have a shower chair and you go to move it around and it's really loose like this, or any of their other chairs, it's a simple screwdriver. You just tighten that screwdriver. If you have one, I'll do it right now because I kind of need to use this. So we just tighten it a couple turns. Usually it'll be fine. That goes back to risk management. You are effectively risk managers. So one of the things I do is I'm involved with our State Home Care Association, and I help our statewide Fall Prevention Alliance. Did you know that your job is the most cost-effective way to help people manage functional impairment? And functional impairment means moving around, taking care of yourself, dressing, bathing, cooking. You're the most efficient way to take care of someone who has trouble with that. Did you know that if you have 3 or more functional impairments, it's almost as expensive as having cancer? Because of all the cost it takes to take care of that, yeah. So here we go. Yeah.
Thank you for fixing
This one's
that.
way loose on this side. Right? So when you're here, the reason that it's cost effective to care for someone, see now it's a lot more stable, is that you do little things like that. And you're helping protect someone when they're moving around, right? So I need a volunteer really quick. Okay? So I'm going to have you in profile so people can kind of see, actually probably like this is where people will most see. So, and I want you to watch really carefully. I want you to arch your back, look at the ceiling, and try to stand up. Okay? Yeah, that's good. That's perfect. That's perfect. So what happens with the weight shift? If her shoulders are still over her bum, she still has to get the distance. It's actually a math equation, the distance between here to her feet. And so now when you lean forward, the center of gravity, picture a plumb line going forward, 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 keep going. Now the plumb line is over her feet, now stand up. So now, the weight was shifted before she even got up. Okay, just rest here for a second. So why do I care so much about that?
Less strenuous for you when you're lifting somebody up?
I don't want you to lift anybody up.
Yeah.
I don't want you to ever have to lift anybody up. Once in a while, right? Who do I want to lift up? I want the patient to be the one lifting themselves up. And if you can guide them to this position, then they're going to be doing more of the work. Now, we know there are things that keep people from leaning forward this far. What keeps someone from leaning forward far enough to do their own transfer?
Losing
Well, they have
balance.
quadriplegia, of course. They can't, they don't, then it's a full assist transfer, right? We're just, like I said, we're just talking about the basic sit to stand. We'll go over those
Losing
others later.
balance.
Say fear.
So wait, let's go one at a time. You said balance. So what is it about balance that would keep you from leaning forward like that?
Once they start to go forward, they don't exactly know when to stop.
Okay. Have you ever had someone fall forward like that?
Couple times.
A couple times. In my experience, the only people that fall forward like that are drunk or they're over medicated. Right? If they have too much medicine,
Yeah.
or in rare cases if they have like a really weird medicine reaction. And most of the time it's an opiate overuse. Like the 4 or 5 times I've seen it, that's the case. And once or twice someone was drunk and they had diabetes, which is like insane. So most of the time falling forward, they don't actually fall forward because they don't let themselves get that far. But if they do have bad balance, why won't they go that far? What is it about that position?
They're
Right?
too far back.
There used to being, what do you mean? You explain further, please.
They're too far back, so if you have them bring their bottom up to the
Oh,
edge.
too far back. We're gonna come back to that. I love that comment, but I wanna talk about balance a little bit more because balance is a huge driver in this. What could make someone have balance issues?
Vertigo.
Vertigo. Vertigo is a rare thing, but you can have dizziness. Vertigo is when the room is spinning. And dizziness is a little bit like that, but dizziness is a little bit less intense version of that. You can get dizzy from a lot of different things. What could make you dizzy? Or have
Blood pressure.
your blood pressure is what?
It drops.
Too low or too high? Right?
Sugar.
Too low is most common. What keeps people's blood pressure too low?
Not enough dehydration.
Not enough hydration. What makes you have a urinary tract infection?
Not
enough
hydration.
Yeah, why? Because your blood pressure is not high enough to push fluid through the
Kidneys.
through the kidneys and into the bladder. If you don't have enough fluid coming through, then it's really easy to get a urinary tract infection is one of the number 1 causes of falls in the elderly. I mean, think about how many times your patients get a UTI, then they're like crazy for a few days, and then they fall. So they have that vertigo, they have dehydration, so when they stand up, they can also have orthostatic hypotension, which means their blood pressure drops when they stand up.
And confusion.
And confusion. So if you think about the hallmark signs of a urinary tract infection, you think of confusion, think of what else? What else is going to tell you an early warning sign that your patient has a urinary tract infection?
They have to go a lot. They have
Frequency,
that feeling
increase in frequency. Very good, that's excellent. With low output, that's very
Yes.
high frequency, low output. What else? Odor is actually not one, and I was reprimanded by a gerontologist about that.
Oh, really?
Odor happens when you're not clean.
Oh, interesting.
Yeah,
Okay.
odor happens when your urine's concentrated, right? But it's not when it's an infection. It's actually a cleanliness and a concentration issue, which may be concurrent with having UTI because you're not. I was surprised. I was reprimanded by that. I was like, okay.
Okay, interesting, that's an interesting point.
It is. It's because we know people that really smell bad, and you have to endure that sometimes, and it's hard. And I've been there with you. Okay, so we talked about a urinary tract infection. So if you see those things, they're not going to necessarily feel burning, especially as they age, but having the confusion, their blood pressure might be low because they're dehydrated. They may have high urine frequency. They may have dizziness, and they may have like an emotional lability, emotional change. Okay, so we're going back to what's another thing that can cause someone to be dizzy?
The vision.
Pardon me?
The vision.
Well, dizzy,
They said they can't see, they can kind of.
but dizziness is a little separate. Vision is something that affects what they see. But a stroke, yeah, did you say that? Yeah, a stroke could maybe the way your brain processes the input can do that. So those things we can go a long ways with that list. But really, okay, yeah, one more.
I tend to suffer from dizziness, and it's usually because of fluid and pressure in the inner ear.
Yeah, exactly. That would be like Meniere's causes that. Exactly. So if you're, one more thing about dizziness, what position do your patients spend most of the day, or your people you take care of? What position do they spend? Laying down?
Sitting.
Sitting in what position?
Leaning back.
Leaning back, yeah. So if you spend all your day like this, or even further down, laying down, what becomes upright? What does upright change to be? You start to think that reclined position is upright. And so if you go from what you think is upright to leaning forward, you feel like you're all the way falling down.
Right.
It's called postural set. And a change in postural set to think that this is, upright, coming to here is going to feel terrifying because you're already halfway falling over, and then to go forward enough to do the transfer. So our role is to try to keep those people from feeling terrified when you do it. So let's talk about another cause that keeps people from leaning forward. And you mentioned, or no, someone else. There was another cause you said about people sitting too far back in the chairs. Maybe it's hard to come.
Have them come up as far as they can.
That's a technique we're going to go to, but why is it that they need to do that sometimes?
It's easier for them to stand.
And why is it easier to stand? It's because the back of the chair is lower than the front of the chair. This is not a good example of a chair that has that, but if you all look, this chair is almost dead even, right?
Mhm.
But all chairs that are, worth a crap, they have a little bit of what's called dump. So that maybe 3 to 5 degrees difference in height between the front of the chair and the back of the chair. And the reason is so gravity will pull you in. A lot of wheelchairs have, if they have CP, they maybe even have exaggerated, they have recline. And if you have to go from a low point to a high point, it's really hard to do that. Yeah. So let's talk about what specifically though in your shoulders keeps you from leaning from your body, keeps you from leaning forward enough to do the transfer. Just 1 or 2 more things really quick. What would keep someone from bending forward?
Pain?
Pain in their back. Yep. And their hips. Yep. Well, yeah, but maybe, yeah. If it hurts really far to lean forward, they have a injury. Pardon me? Yeah, because maybe they can't. Used to when they did the posterior approach, you couldn't bend more than 90 degrees. Now they do fewer and fewer of those, but it's still an issue. Okay, so our job is to help people lean forward as much as they can safely without hurting themselves. And then when they do, they've done the weight shift before they actually try to leave the seat. So do you have any other questions about that? All right, so if you had trouble leaning forward and somebody was trying to help you stand up, how would it go? So I need another volunteer. I want you to think about that. You stay here. I need someone to help her get up and pretend like,
Well, I know what I've done in the past.
Well, I just want someone to help you stand up. So, take me through how you do it.
Her or me?
Well, you're sitting down. I want her to get you.
What's your name again?
I'm Val.
Hi, Val. Hi, Val. So what we want to do is we want to have you stand up, and then we're going to transfer you to the commode, okay?
Okay.
So I need you to help me, all right?
Alright.
So we're gonna have you sit forward, and then don't grab onto the handles, and let's see. Mom, I want you to give me a hug. Can you give me a hug? Okay, and we're gonna go on 3, okay? 1, 2, 3.
Okay, and then you were going to sit down.
And now we dance.
Okay,
Yeah,
very
yeah.
good. Very
Do a
good.
little
Thank you.
step.
Have a seat. I appreciate that. So, if you don't mind, what did she do right?
She had to come forward.
She'll have to come forward.
Should I explain what she was doing?
Very good. That's like my most important thing. She
Yeah.
explained what she's doing. What else?
Told her to give her a hug to put her arms around her neck.
Okay, I'm
She
gonna
made me participate.
dispute on the hug part. We'll talk about that more in a minute. And she helped.
Made me participate.
She made you participate. Okay. What could have been a little better? I mean, we're going to do this a lot with a lot of people, so I'm not saying one person now.
She's used gate belt.
Why?
It's safer. It gives you something to hold on to, and a lot of times if you grab on the pants line, they can rip. And the hands.
No offense, but I hate gate belts.
I
I use gate belts 1 in 100 times, and it depends on your corporate policy. But how do you know you even need a gate belt if you don't talk to them about it? So that goes back to my biggest problem with that, right? And you were doing the best you could, like we didn't give you very many parameters. One of the things I always look for is to ask the person how they want help. So if see the cool thing is you guys know these people, you work with them more than just once a week usually, or more than just once. And so you work with them enough to have a system you work out together. The fastest way to understand how someone needs to be helped is to ask them. Not always, someone has a lot of dementia, if they have, they're nonverbal or whatever, they may not do that. But if you ask someone, how would you like to be helped? How can I help you? We need to do this transfer, we're gonna go, and you did a great job of defining, we're gonna go to the toilet. And that was key. Here's our goal, right? But to do that, if you ask them, how would you like me to help you get to the toilet? It sounds so simple, right? Because we don't know how much help she really needs. And of course, this is kind of a fake scenario, because you already know these people well enough to know exactly kind of what they need. You do your assessment. But the first few times you work with them, and maybe even from day to day, some people are going to change a little bit. My back hurts really bad today. I'm going to need a little extra help. That kind of stuff. Now, one thing you said was interesting. You said, don't use the handles. What did you mean by that?
Like if they're in a wheelchair or they're at their chair recliner, they'll go to like grab and then they'll start to fight. So if you get them engaged and you ask them and let them know, you don't need those, don't grab those.
Well, do they?
But sometimes if they can push themselves
Do you have
up.
a chair, Kenzie?
I think they need
Like
them.
a small chair?
I think they need them.
Some of them do, but I've got a patient where she just grabs and she
Yeah,
forgets what she's doing and
yeah.
she's like, ah.
Well, okay.
So
That's one example.
For her.
For her, yeah.
I
But
would do
generally
that.
speaking, though, is it easier to get out of a chair with armrests?
Yeah.
Yeah. Why?
Because they can have something to push up.
Put your weight on
Push
it,
up on.
push up.
Yeah.
Yeah.
Good for the arms.
Yeah. So what are we doing when we do that? What we're doing is we're moving. Thank you. We're gonna move. I'm actually gonna lean it against here so it doesn't roll. And I'm gonna lower it. Ooh, no, I'm not.
We should lower.
It's the other one.
There's another
Yeah,
forward.
there's another one.
There you go.
Yeah, there you
All
go.
right. So.
Oh, that's really low.
Now, when you look at me, like, if your
Tall,
knee
long legs.
is below, so the reason tall people lean their chairs back is effectively makes it so that the front of the chair supports their whole thigh. Because when you're sitting like this, all your weight's on just your sitting bones and not your whole thigh. That's why people do that. But so with this chair, if you're sitting up and you want to do the transfer fast, I want everybody to put their hands on, here, do this beside me. I want everybody to put your hands on the front of your chair. And then I want you to try to use that to go up and stand up.
It's easier.
All right, now come back down. I want you to take your hands, and instead of pushing your body up, I want you to push your body forward and then stand up. You're nodding your head.
It's easier.
Why?
Because you have the core of your body moving.
Do you mind volunteering once?
Sure.
Have a seat right here. Okay, I want everybody to see this. Okay? So this time I want you to push up and then forward. I'm going to hold the chair for you. Push up and then forward. Okay, now come back down. And now I want you to push forward and then up. So did you see the subtle difference with that? Now you're nodding yes. What's different?
I thought it was harder
I thought
for her to
harder
get
for
up. The second time, it was harder for me to get up when I leaned forward.
It was
Well,
easy.
Well, I want you to experiment on an ideal chair, like when you can all play with this stuff. Most of the time, pushing yourself forward a little bit really makes a big difference because it lets you get the center of gravity onto your feet a lot faster. So now let's because this chair moves. I don't want to use it again, but let's go back to the scenario. And this time, would you be the caregiver and you be the patient?
Okay.
And then what we're gonna do is use this. I'm just gonna push this over here. And I just want you to pretend like it's kind of hard for you to get up and you could physically get up, but you just don't want to lean forward. Okay? And then you're just gonna help her stand up.
Okay. How would you like me to?
Well, first of all, define what you're gonna do.
Yeah.
Okay, we need to move you over to the commode.
Okay.
So how would you like me to?
Pull me up.
Pull you up?
Mhm.
Okay. On the count of three, right? Can we lean forward a little bit?
Yes.
All right.
1, 2, 3.
All right.
Yeah.
Excellent. Okay. Have a seat.
Me?
Yeah, both of you guys. So you did great. So what was right? What was good?
Asking her to lean forward.
She asked her to lean forward. Define what you're gonna do. What else?
Oh, I'm asking how I can help you.
Asking how I can help you. What else?
So I'm gonna lean forward.
We already said that twice.
Oh, sorry.
That's okay. What else did she do good?
Let the patient do most of the work.
Did you? Did you feel like she did most of the work?
She did, I think it was probably 50-50.
Okay, good. So 50% of the work is called moderate assist.
Yeah.
Moderate assist means that you're doing half and they're doing half.
Mhm.
Okay. Minimal assist is 25% or so.
I would like to know if I could help assist someone that's sitting down.
You want to be the next volunteer?
Yeah.
Okay, great. We'll have you do that.
Okay.
What could have been better? We always have to ask that. What could have been a little bit better? Well, actually, one more thing that I really liked, her body position. Can anyone describe her body position for me?
Who's?
The Val's.
She was off to the side a little bit.
She's off to the side beside the patient. What does that do? That lets the patient lean forward. If you're right in front of the patient, you can do this, and most of them are going to be from the front, but you still have to move out of the way. From the side, let you do that. Okay, good. What else did she do?
She tucked her arm completely underneath her,
Yeah.
and the patient, you've tucked your arm completely underneath.
And that's a good and bad thing. I think in the right circumstance, it's fine. But the problem with that is if you're here and they go away from you,
Well, I also have my arm around her back.
yeah, your arm around her back. That's
This
the
one
part I
around her
did
arm
like.
and this one around her back.
Yeah.
So I have,
So we'll do a variation on that. So it's a mixed blessing, right? Because you're here, you're really close. When you get close like that, what does that do to your center of gravity as a caregiver?
Up.
Up?
Like off, because you're through, I don't know,
You have your
you
center of
bend your
gravity.
legs and then,
My point is you have your center of gravity close to theirs.
oh,
With
okay.
all these things, you want your center of gravity close as you can, or as a fulcrum. So most of the time, though, you want to be really close to them. So if you're down here like this, what's your base of support?
Back further,
It's nice and wide,
nice and wide.
and it's offset. She actually she was like this. One foot was a little bit in front of the other. She bent her knees, and you kept your back straight too. You didn't curl. You were like this, actually, which was pretty rare to have someone do that. That's pretty
Was that
good.
good?
Yeah, it was really good. So you were like this. Your back was straight. A little bit of arch. You kept that neutral spinal position. You hinged at the hip. You bent your knees. But for the most part, I mean, everybody's going to have corrections in technique, but you weren't clearly doing this kind of thing. I would have probably been scared of that.
So are you saying it's best to be off to the side most of the time?
No.
No.
No, but I'm saying in this case it worked because the person needed to come forward. Now, let's try it again. You want it to be, well, actually, do you mind volunteering for me once? And then I'll have you come back and demonstrate in a second. So another way to do that would have been to say, have a seat please. So pretend like we've already introduced ourselves and we're just going to stand up and I ask you to get up, but you don't want to lean forward. Physically you're able to, maybe you have dizziness, maybe you have something else. So if I could help you, how would you like me to help you get up? Pretend like you don't know that you have this dizziness trouble or you don't want to talk about it or whatever. How can I help you get up when you don't want to lean forward? That's what I was getting at with the question. I didn't ask it very well. So can I help you up?
Sure.
Okay, so we're going to get up. So would you do me a favor and lean forward? Put your hand on my shoulder. No, I don't want. Please don't grab my shoulder because you could pull me down to the floor and I could break my back. Right? That whole hug thing, makes my heart weak. Every time I see someone do this, it just makes me have chills on my spine because you can hurt your back faster that way than any other way. And I know a lot of people love it because the patient feels like they have a good place to hold on to. That good place to hold on to is what's going to kill you one day. It's going to ruin your back. So we'll try to show you a way to not have to do that. Okay? But what I just want you to do, we're going to stand up. Would you please lean forward? Put your head on my shoulder. Put your head on my shoulder. Now stand up. Now stand up. Now you weren't going to lean forward, and I just basically stood there as a stopper to make sure she had something safe in front of her to guide her forward. Did I do any work? A little bit of work to squat down, but that's it. So now, have a seat again. Pretend like you don't want to lean forward. You're not going to follow me. So may I put my hand on your shoulder? Okay. So lean forward for me. Lean forward for me. And then now stand up. Okay, that's one way to do it. Now have a seat again. There's a progression here, right? So this time, you're not going to lean forward. Okay. May I put my hand on your waist to help you up?
Sure.
Okay, so lean forward just a little for me. And I have to grab your waistband. Is that okay?
Yeah.
Okay. So I'm going to grab a waistband. Now, when you grab someone's waistband, you're right, you could tear their pants. But there is a couple of things to know. One is, I'm not putting any force on this hardly at all. Once in a while I do. When you grab it, how do you grab their waistband? Curl up. Why? You don't want to dip your thumb down their pants and get it all wet and nasty. I mean, let's just be honest, right? I don't want to put my thumb in anybody's junk. So you're grabbing like this, right? So lean forward a little bit, please. And then I'm going to grab here and try to grab that now. Now, pretend like you don't want to lean forward. You don't want to lean forward. Right. So what does she do? Kind of push back. But what did I do?
Pulled her
I
forward,
pulled her forward. How?
by moving her center of gravity, helping her.
I'm
move.
using my shoulder to pry her forward. Right? Okay, thank you. So I want y'all to know that this is a very forced scenario, and I'm showing you one part of a multifactorial thing. Getting someone out of a chair is complex. Once in a while that trick works. It doesn't work every time, right? But in general, the quicker you get someone forward and onto their feet, the better it's going to go. So now, do you mind volunteering for a second?
Sure.
So pretend like you physically can't do it, you're just weak, and maybe you have some pain issues. How am I going to help someone who needs minimal assist or max assist? Or how am I going to get them up when they physically don't have the juice to do it? So what do you think? What should I do? Do you want to try first?
Okay, I'm gonna get you up.
Okay.
How would you like me to help you? Every morning?
Nope, I'm completely.
Okay, I'm gonna put my leg right here.
Okay.
Have you put your arm here? And then I'm gonna go over here and put you.
Oh yeah, just sit, for the sake of this, we're just stands fine.
Okay.
Yeah. All right. So what did she do right?
That's for us, how she help him.
Mm-hmm.
She put her foot in between his 2 feet.
Okay. If I'm a dude and you do that to me, that's not a good thing.
No.
Why?
Your knee is right on the same level as the groin.
Yeah, it makes me anxious. But that's okay. I mean, everybody has to work it out, right?
That's how I was trained.
Yeah.
You know.
And like I said, there's not going to be a complete right or wrong way, right? What else did she do right?
Well, she did explain why she put her foot in, or that she was gonna put her foot in between.
What use does it give you to have your foot there? What does it do for you?
It just it's more of a balancing thing.
Yeah, so you got a wider base of support. You got
Yeah,
front to
and I
back
have my
support.
foot back here, so.
Okay. You go through the motion again and take them up again. So what does that do? What does that do for you?
I've got him holding on to me, so it will be easy for him to stand
I'm
up.
just wondering, like, how does that help him? What is it about that helps him? Does it make him feel more secure, or?
I think it's a secure thing too.
Okay, I think there's another thing I'm going to show you in a second. So keep going, and then you put your arm under his arm, and I love that. So what her hand is doing? Can you turn and show everybody what your hand's doing?
It's on the back.
So it's on the back. Where on the back specifically? It's on his scapula, and she's grabbing that. And then the last second before you stand up, you do one more thing that I really like. So go back down one more time. And the last second before you stand up, you're bent, and then you actually put your weight subtly from your front foot to your back foot.
Yeah.
Okay, so now let's go have a seat, and I'm going to do the same thing with you. All right. So now the subtle differences are, if someone is grabbing you here, what do they have to do?
They have to move forward.
They have to lean forward. So you're creating the weight shift when you do that. So that's why it's okay. He's also grabbing at your center of gravity. So if you had to have someone grab you, grabbing your center of gravity is least likely to tweak your back.
Then what if they do this?
See, I don't want them
and
to do
then
either.
they're doing this, like, ah!
I don't want them to do either way. I really don't want it
Because
either way. And what I want is to have their hands on whatever they're sitting from. Even if the chair like this, if they're big and they can't, then I try to find something like a table or something right by it. And nothing's ideal, right? But if they had a wheelchair, put your hands on the armrest of the wheelchair. Because we're going to use that. They're going to do the pushing forward. Now, if you're here, instead of putting my leg here, which is terrifying as a dude, I'm going to have my foot by your foot, right? And I'm going to actually touch part of my leg here and move your foot over just a little bit so I don't kick the chair. So I'm going to put my knee kind of by my shin, by his shin. And I'm not touching shin bones, I'm touching the soft parts. When you're with anybody else, when the soft parts touch, it's way better, right? Than anything, right? So you don't want to be, kicking someone in their arthritic shin or knee. So then, may I put my hand under your arm? Okay, so I'm going under here, and then I'm going to go like this, and lean forward, and then come back and stand up. So I put them too far forward. Now, go back. I don't want you to help me at all. Please don't help me stand up, okay? So go like this. I thought you were going to help me.
Barely.
Barely, yeah.
Yeah.
So what did I do okay? What was different about what I did?
The stance of your feet were further apart,
You started out actually,
closer, but you
and then I went
moved it
further
back.
apart. What am I doing when I do that?
Shifting your center of gravity.
And why is that? Why am I
Because
going
you're
away from
bringing-
him?
Because you're bringing him up and changing.
Because you're bringing him towards you.
Yeah, so my center of gravity is the ballast. It's pulling his center of gravity up. And when I have my leg blocked on his, you guys take any lessons in physics? It's basically a fulcrum. So this point where we're touching is the fulcrum. His femur is the lever arm, and his center of gravity is the thing we're moving. And I'm using my femur and my center of gravity. So I go down like this, I get close to him, and I move forward and I step back. And when I step backwards, you launch.
Mm-hmm.
You can feel like a huge change. So what a lot of people do when we practice this is they go like this, and they stand them up, and they arch their back. We don't want that. And you kind of did that here. You went from here to here, and you kind of went from front to back. And I'm exaggerating things, and it's subtle, right? But when I'm doing this, this is really exaggerated, and you don't need to do it all the time. You need to do it when someone needs a lot of help, right? The point is, I didn't have to do it because you didn't think you were going to help me, but you just did it. The reason you could do it is I took you through the right position. Does that make sense to everybody? So now, I want to practice something. I want everybody to stand up. Wait 1 second, watch me first. And you're going to put your foot by my instep. And you're going to bend forward a little bit, and you're going to touch the soft part, please, only the soft part. And then you're going to grab arms like this, and you're going to lean back and try to pull me over. So step back. Step your foot back. No.
No,
If you do it like that and you slip, he's going to bust his can. Step your foot way back behind
way
you.
back.
Oh.
Yeah, there you go. Now, then you're protected, right? So pull me over, right? So I want you to feel how much force you can give with that. Be careful, don't pull your partner's arm out of socket, but everyone needs to do it once. Okay? Everybody match up. Demonstrate the whole process, right? This is for people who can stand. We know that if you have CP, it's going to be a lot different scenario, but I want someone who hasn't been up yet, 2 people who haven't been up yet, to demonstrate this. And you know, of course, we're going to pick your form apart, right? But the point is, you're going to do some things right and some things that need adjustment.
You're stronger than me.
One more person.
Come on up. All right.
I'll sit.
You sit. So just pretend like you've already talked about everything, and just explain what you're going to do.
Okay, I'm gonna help you stand up. Is there a specific way that you'd like to?
I don't want to get up, but you can try.
Just do what you do. Okay. So I'm gonna put my leg here.
Okay.
I need you to put your arm here. Okay. Ready?
So wait, let's talk about this. First of all, what is going to give you if you put your foot like this? What is that going to do for you? And we practiced this way when we did the demonstration. But I want you to relate it to the other principles of having your body aligned with their body, right? You're brave to come up here, you know, but you know I'm going to do this way. So you're doing awesome. So what can maybe make you, if you're doing this and you try to lift someone, what does your torso do compared to your hips? You're twisted automatically.
Twisted, yeah.
Yeah, so that twist and lift is what?
It's bad, Joe.
Yeah, it's bad, it's terrible. So you can start out and you've got to be square on them, and you have to block their legs slightly different than we practiced a minute ago. Okay, and then I don't want her to grab you. I mean, if the last resort, someone can grab you, but don't on purpose ever let anybody do that. I mean, if you can get away with it, don't encourage anyone to do that. It's just a recipe. If they have a bad shoulder and you put their arm there, and they pull on it, they can still pull their arm out of socket. So some circumstances is going to be okay, but don't start out that way. Start out with the least amount of work possible for you and the most for them. And it's not because you're trying to get them to do the work. You're trying to empower them to move themselves. Does that make sense? Okay, try it again. Okay.
Legs bent, your speed. There you go. Okay. I'm gonna give you a small hug, okay? No, put your arm in.
You still have to block her leg. You still have to block her leg. So just use your foot on the outside of her foot.
Outside.
Yeah, and then find the sweet spot. And then grab her shoulder blades. Get up right up under the scapula.
Okay.
And then take a step back. All right. How did that feel for you?
That's a lot easier.
Felt all right.
What was easier about it?
I didn't have to do anything.
Kind of let you.
It's basically a passive. It's a combination of passive and active. So you're not really using a ton of muscle work because you just take a step back, and when you do, the physics of it pulls the person forward. All right. What else did you feel? Did you feel like you were going to launch, or?
No, I didn't feel like he was getting into my side this time, so
Yeah.
it was better.
So it felt more comfortable having his hands on your shoulder
Yeah.
blade. Okay. Always ask for permission before you do this, and always make sure you're wearing gloves or whatever, because you might get your arm wet. It's a real thing. But if it's okay and they're the right thing, you can grab their shoulder blade. It's a very innocuous place to touch. There's no intimacy involved with that, but you do have to go under their arm, and that is more intimate, right? So ask for permission before you do any of these things, because it just is. But if you can do that and you get their shoulder blades, then you initiate and you step back. I want everybody to practice this one time. Just go from sitting to standing, get a partner, preferably the same one you did the other thing with, and go from sitting to standing. Like someone was popping you out of the chair, right? Yeah. And you felt it easy to get up.
to get up.
Did you have to do any work? A little bit, right. But what else did it feel like? Did it make you go through the right position?
Yeah.
Okay. All right. What did it feel like to do it, to be the one helping someone?
Easier.
Okay, so much easier is helpful, but why?
Because it's on the back.
You didn't strain your back.
Right. Working smarter, not harder. Yeah.
Yeah, so you didn't strain your back. What else is easier?
I don't have to lift. I don't have to pull the person up.
Yeah, you should not be the one pulling up. Once in a while, you have to. You need to be ready for that. So the whole point is you have to have great body mechanics. So when I'm doing this, I'm here in this athletic position, and I'm taking a step back. So you were still trying to go up, even at the end. You have to love, one thing that we learned in doing it is when she started to pull on me, she took a step back before she even pulled on me. And so here she is with a bad mechanical advantage, bending forward and twisted, right? So you can't pull until, you can't step back until you pull. You have to have some tension on their shoulders. And then when you go back, it's that fulcrum point. You don't need to do this for everybody. You won't be able to do this for people who need it. Sometimes they're going to need more. Sometimes you block both your knees and you stand up. One person asked, what happens when you get them up and they're not stable? And just for the sake of it, do you mind? Okay? So if I get you up and you're not stable, I'm just pretend like we talked about everything, we're just going to do it, right? So I go here, and I bend, and I go up, and he's limp. What am I going to do? First thing I do is I step right back to him, and I put my hand on his sacrum. So now, if you go limp, are you going to lay down? Are you going to sit down? No, he's not. This is really intimate, right? So pretend like he has spasticity in his legs, and he wants to, pretend like, so now you're up. Pretend like you're straight. Okay, so sometimes people with CP have spasticity or a stroke, and you can't get one leg to bend. And so if I'm here and here, I can control them wherever I want, right? Or if I'm here and here, I can do that too. But if they don't want to bend down and you're still blocking their leg, and maybe it's locked because they have hemiplegia, take your thumb, put it right on their ASIS, it's the bone right here. They're going down no matter what.
That's where we can see that.
We can't see that.
So I took my thumb and I put it right on. So your ASIS is this bone right here in the front. It's the front part of your sacrum. Right, and if you just put your hand on that and your other hand on their shoulder, they're going down. You should all try this at home with someone else. Pretend like somebody has a walker. What do? We have two more things to work on, and then we're going to be done. Two more important points. If someone has a walker, how do you guys do that?
We have a walker.
Right. Please. Yeah. So how do you handle it when someone has a walker and you're trying to get up? You can't get in front of them because the walker's there.
Alongside them.
Alright.
Yeah,
Is it bad to step in
you
front
have
of
to
the
go to
walker?
the side of it and hold the walker down, so the walker doesn't come back up as they pull themselves up.
Walkers, well, today's walkers tend to have
All right,
brakes.
so first of all, after I'm done, you're gonna switch these out, because the wheels go in the front, and that goes in the back, all right? Okay, second one.
You are so right.
So now, if you're standing here,
We need to have you come like once a month.
and
Keep everything in
yeah, I
check.
got my bearing. So now, if you're here and you're trying to get someone out, the thing I see in every assisted living is they slam the walker right in front of them. The patient reaches up and grabs the walker and pulls on it.
No.
Yeah, why not?
Because it's not gonna do any good,
Because
because
they're gonna fall backwards.
Because the
back.
walker's terrible ballast.
Walker
Yeah.
changed them.
Yeah.
Yeah. So the option is really
Stand
to
on
have
it
your
first.
hands down low and push on the chair. Now, one case is a different one, but I wonder if you approach it slightly different, if she'll be able to do it. We don't have time to talk about it now, but just you have another set of things to try. Right? That's the point. You got something you can try that's a little different that maybe takes weight off you. And no, it's not completely going to fit every single person. But if they do have a walker and you have it right in front of them and you're trying to get them to lean forward, what happens?
Hit the walker.
Yeah. So having this walker out in front of them a little bit helps sometimes, because then they stand up and then they grab the walker. And a lot of times if people have back pain, you can have them lean forward and they can grab the bottom of the walker or the top of the walker preferably. And then they're not spending that time with weight all on their back. Does that make sense? So they got weight on here, and stand up. This goes back to the final point for today. If you have a hard time getting out of a chair, how do you practice getting out of a chair? When is your chance to practice? How do you get better at it?
When you're alone watching TV.
No, if you have trouble,
Oh.
it's all you can do to get out of a chair. How are you going to learn it? How are you going to get better at it?
Repeat it.
How? If you're struggling for your life to get out, it's all you can do to get out. Can you practice in that environment?
No.
No. The time to practice is when you're going from standing to sitting. So all these people, they come with their walker, and they do this weird, stupid thing where they back up, right? You really want them to go, walk by the chair. Holy cow, this is weird. You have them touch the chair with their legs. And if they're afraid they're going to fall forward, leave the walker in front of them for a second. And you can stand beside them, and you can do this same technique that we kind of did, right? You can be here for them. You can have your hand on their knee and block them that way. That's another really great strategy. So instead of doing this hook thing, you can have your hand on their knee, right? But those are all variations. The point I'm getting at, though, is if someone's afraid, you need to get them to sit down in slow motion, because they all come and do this. They all lean forward and use that same terrible technique that's preventing them from leaning forward enough to get out. So you have to make them do the optimal technique on the way down. You have to lead them to it. You can't make anybody do anything. So if they're here and they're trying to sit down, what is the thing you're going to ask them to do?
Lean forward, squat.
Yeah, lean forward. So how are you going to get them to lean forward when they're terrified of leaning forward? It's kind of hard. It's hard. I struggle with this every day. But the thing that's working for me lately, and I'm just going to change, is I have them hold the walker, and then I have them grab the chair. Hopefully they have an armrest. And then I have them look at their shoes. Because if they do this and they sit back, they're still not going to learn the good technique. Right? Almost everybody's stage dives. They drop back in the chair. But if you ask them to look at their shoes, sometimes it works. So you have them keep your face on your shoes. You know, if they're blind, put a white sock down there, start carpet, or a black sock if it's light carpet. Put something visually that will cue them to have their head forward. And it's just one way to help them sit down. And it shapes how they get out of a chair. Because if they're terrified of leaning forward because they're so dizzy, they're never going to lean forward on their own unless you're there. The whole point is to get them used to using a technique so that they feel safe using good technique, right? So if you can get them to use the good technique for half of this experience of getting into and out of a chair, then maybe they're more likely to do it the right way.
You said something that kind of sparked something in my head, because I told you earlier I suffer from dizziness, not vertigo. So when I'm dizzy, it's like the inside of my head is a gyroscope. You know, the room is still.
Bending forward would be terrifying.
And I have found that I can function perfectly well as long as I have a strong focal point. So that object on the floor is a strong focal point, and that really helps with
The other
dizziness.
way to call it is it's a visual marker.
Yeah.
So that's one of the strategies we use in therapy with someone is a visual marker. So if you're walking down a hall in an assisted living and there's an exit sign, or someone's, weird Greek goddess.
And I gotta tell you, when the
or
inside of my
whatever they are.
brain is,
That actually truly is vertigo. If your head's still and the room's spinning, that is true vertigo.
well, that's what I said.
Yeah.
When I'm dizzy, the room is perfectly straight and still. It's inside of my head. It's like a gyroscope.
And using a visual marker like that,
And the
it's a
visual
fixed
marker
point.
It's
It's a
something I
classic.
always do. I mean, I can drive with the visual marker. I can walk down the hall with the I can do whatever I have to do. As soon as I don't have to do anything, I get really still.
Yeah.
But when I have to do something, I can get up, I can move, I can follow a straight line as long as I have that visual marker right.
So, I know there are special cases that I can't address today, but when it comes to this basic sitting to standing, turning, you guys feel like this is kind of some tools that you maybe didn't have? So you have good intuition because you've been working with people, but the thing that a lot of people go to is to help their patient feel secure, they'll let them grab something. And sometimes it kind of works that way, but the less of that you do, the better. Because what we really want is to shape the behavior of this movement so that they're doing it. All right? No questions?
Very helpful.
Let's do this right now.
I'm gonna